Have you ever woken up in the middle of the night with a burning sensation in your chest, a bitter taste rising in your throat, and a strange pressure that makes you wonder, is this just heartburn or something more serious? Many people dismiss these symptoms as a simple stomach problem. They drink a little water, maybe take an antacid, and try to fall back asleep. But what most people do not realize is that nighttime heartburn is not just uncomfortable. It can be a powerful warning sign from your body. In my decades of medical practice, I have seen countless patients ignore these signals for months or even years. What begins as occasional acid reflux can slowly develop into chronic inflammation, damage to the esophagus, and in severe cases, even precancerous changes. So today, I want to explain something very important. We are going to talk about the warning signs of acid reflux, especially the symptoms that appear at night when your body is most vulnerable. Understanding these signs can help you protect your digestive system, improve your sleep, and possibly prevent serious long-term complications. Let's begin with something many people experience but rarely connect to acid reflux. One of the earliest warning signs is frequent nighttime heartburn. This is the classic burning feeling in the center of the chest, often spreading upward toward the throat. It usually happens after dinner or when you lie down to sleep. Why does this happen? Inside your body, there is a small muscular valve called the lower esophageal sphincter. Think of it like a gate between your stomach and your esophagus. Its job is to keep stomach acid where it belongs, inside the stomach. But when this valve becomes weak or relaxed, acid can travel upward into the esophagus. And when you lie down at night, gravity can no longer help keep the acid down. That is why symptoms often become much worse when you are in bed. Many patients describe it the same way. They fall asleep feeling fine, but 2 or 3 hours later, they wake up suddenly with a burning chest, coughing, or a sour taste in the mouth. Another warning sign people often overlook is a bitter or acidic taste in the throat when waking up. If you wake up in the morning feeling like something sour has reached the back of your mouth, that is often stomach acid traveling upward during the night. Over time, this repeated exposure can irritate the throat, damage tooth enamel, and even affect the vocal cords. I have seen patients who thought they had simple dental problems or throat infections, when in reality the root cause was chronic nighttime reflux. Then there is a symptom that surprises many people: chronic nighttime coughing. Some patients tell me, "Doctor, every night I start coughing when I lie down." They assume it is allergies or a respiratory issue, but in many cases, acid reflux is silently irritating the airway. When acid reaches the throat, tiny nerve endings react by triggering a cough reflex. This is the body's way of protecting the airway from stomach acid. Over time, this constant irritation can cause a persistent cough that seems to appear mostly at night. Closely related to this is hoarseness or a sore throat in the morning. Imagine delicate throat tissues being exposed to stomach acid night after night. Even small amounts can cause inflammation. Many people wake up with a dry throat, hoarse voice, or the feeling that they need to clear their throat repeatedly, and they never realize that the real problem is happening while they sleep. Another common but often ignored sign is difficulty sleeping comfortably after eating. Patients frequently tell me that they feel fine during the day, but at night they cannot lie flat after dinner. They need extra pillows, or they feel pressure and burning in the chest when lying down. This happens because the stomach is still processing food, and excess pressure pushes acid upward. Large meals late at night are one of the biggest triggers for this problem. But here is something that worries me even more. Some people experience chest pain from acid reflux that feels frighteningly similar to heart pain. The burning may spread toward the back, the neck, or even the arms. While acid reflux is often the cause, it is extremely important not to ignore chest pain because heart conditions must always be ruled out. That is why persistent or severe chest discomfort should always be evaluated by a medical professional. Now let me tell you about another silent warning sign that many people never suspect: excessive burping and bloating at night. When the stomach produces too much acid or gas, pressure builds up. This pressure can force the valve between the stomach and esophagus to open temporarily. When that happens, acid and gas escape upward, creating reflux symptoms. And when this cycle repeats night after night, it becomes a chronic pattern. But perhaps the most concerning problem is this: many people believe acid reflux is just an occasional inconvenience. They treat it casually, without realizing that long-term reflux can slowly damage the lining of the esophagus. Years of irritation can lead to inflammation, scarring, and in some cases a condition called Barrett's esophagus, which increases the risk of cancer. The good news is that most nighttime reflux problems are not permanent. In many cases, simple lifestyle changes and early awareness can dramatically improve symptoms. But before I share the doctor-recommended solutions and daily habits that can calm acid reflux naturally, there are several more hidden triggers and nighttime mistakes that most people make without realizing it, and these mistakes might be the very reason your symptoms keep coming back. Now let's continue, because understanding the triggers behind nighttime acid reflux is just as important as recognizing the warning signs. In many cases, the problem is not only what is happening inside the stomach, it is also what we are doing in our daily habits. One of the most common mistakes I see in patients with nighttime heartburn is eating dinner too late. Your stomach needs time to digest food. On average, the digestive process can take 3 to 4 hours, but many people eat a heavy dinner at 9 or 10 at night and then go to bed an hour later. When you lie down with a full stomach, pressure builds inside the abdomen. That pressure pushes stomach acid upward toward the esophagus. Without gravity helping to keep acid down, reflux becomes much easier. This is why one of the most powerful medical recommendations is surprisingly simple. Finish your last meal at least 3 hours before bedtime. It may sound small, but this single habit can dramatically reduce nighttime reflux for many people. Another hidden trigger is sleeping completely flat. When your head and chest are level with your stomach, acid can travel upward much more easily. That is why patients with nighttime reflux often find relief when they slightly elevate their upper body during sleep. Raising the head of the bed by about 6 to 8 inches, or using a wedge pillow, helps gravity keep stomach acid where it belongs. It is a simple mechanical solution that many doctors recommend because it works with the body's natural physiology. Now let's talk about something many people enjoy every evening: certain foods and drinks before bed. Some foods naturally relax the valve that keeps acid inside the stomach. When this valve relaxes too much, reflux becomes more likely. Common triggers include spicy foods, fried meals, chocolate, caffeine, and carbonated drinks. Even peppermint, which many people believe helps digestion, can actually relax the lower esophageal sphincter and worsen reflux for some individuals. Alcohol can also be a powerful trigger because it both relaxes the valve and increases acid production in the stomach. That does not mean you must eliminate every favorite food forever. But if you regularly experience nighttime heartburn, it is wise to pay attention to how your body reacts after certain meals. Another factor that many people underestimate is body weight. Excess weight, especially around the abdomen, creates additional pressure inside the stomach. This pressure can push acid upward, making reflux more frequent and more severe. In clinical practice, I have seen many patients experience significant improvement in reflux symptoms simply by losing a modest amount of weight. Even a reduction of 5 to 10% of body weight can reduce abdominal pressure and help the stomach function more normally. Stress is another hidden contributor. When the body is under chronic stress, digestive processes can become disrupted. Stress hormones may increase acid production, slow digestion, and make the stomach more sensitive. This is why some people notice that their reflux symptoms worsen during stressful periods of life. Simple stress management habits, such as deep breathing, walking after meals, or relaxing evening routines, can make a real difference for digestive health. Now let me share a few practical habits that I recommend to my patients who struggle with nighttime acid reflux. Eat smaller evening meals instead of heavy dinners. Large portions stretch the stomach and increase internal pressure. Avoid lying down immediately after eating. Even a gentle walk for 10 to 15 minutes after dinner can support digestion. Choose lighter evening foods such as vegetables, lean proteins, and whole grains rather than heavy fried or fatty meals. Stay hydrated during the day, but avoid drinking large amounts of liquid right before bedtime because a very full stomach can worsen reflux. And if symptoms occur frequently, more than twice a week, it is important to speak with a healthcare professional. Persistent reflux may require medical evaluation or treatment to protect the esophagus from long-term damage. But here is the message I truly want you to remember. Your body is incredibly intelligent. Symptoms like nighttime heartburn, coughing, throat irritation, or chest burning are not random annoyances. They are signals, messages asking you to pay attention. When we listen early, make small adjustments, and care for our digestive system, we often prevent far bigger problems later in life. Healthy habits are not about perfection. They are about awareness, consistency, and respect for the body that carries you through life every single day. So tonight, when you prepare for sleep, remember what we discussed. Give your stomach time to digest. Choose foods that support your health. Allow your body the conditions it needs to rest and heal. Because good sleep, good digestion, and good health are deeply connected. Take care of your stomach, and it will quietly take care of you for many years to come.